We are supposed to carry on working even after we are exposed to the virus. Who will take care of our patients when we fall sick or die, when we are already so short of staff?
It seems like stalling the testing is in part just to keep up staffing.
Treating coronavirus patients but not being tested for it themselves. Health workers are desperate to know if they have it so they can get back to work. Dr. Sarah Hallett has a cough. She's having to self-isolate for 14 days now. Her 2 flatmates must also do the same. They too are doctors.
It's really frustrating. And look, I understand why the government advice exists, but when we know that there could be something that could be done to get us back working on the NHS front line again, that's quite a frustrating position to be in, especially for my flatmates who are essentially well.
The problem is there simply aren't enough trained staff to do the tests or even enough tests themselves. The government insists patients must be prioritised. Last week, the NHS and Public Health England said testing capacity had increased to 5,000 a day. By next week, that should double to 10,000, helping diagnose many more hospital patients. Now the government wants to ramp it up to 25,000 tests per day within 4 weeks. Only then, it's hoped, will NHS staff be tested. And they want to go even further.
We will be very much have an ambition to have some sort of home-based test for the very reason which has been described here, which is we don't want potentially infectious people arriving in hospitals, but we recognise that the public and particularly our key workers want to understand their health status.
NHS staff, though, say this is too little, too late. They're already short in numbers and being put at risk. But health officials say a new test, which can determine whether people have had the virus already and are therefore immune, is just weeks away from development.
That's progressing very fast. Public Health England are looking at this today. It is a game changer, and the reason it's a game changer is that it allows you to understand the proportion of the asymptomatic population who's had this disease but hasn't had symptoms that are in any way significant.
Not only would such a test provide valuable insight into the pandemic, but it could also mean many thousands of people going back to work, including crucial hospital staff.